Hello, folks. Welcome to my channel. My name is Chad Y. Roye, and the name of my channel is What's Up with Chad Y. Roye. I talk about my diagnosis of multiple myeloma and my journey as a cancer survivor. For those who have not done so, please like and subscribe to the channel, turn on your notifications, and feel free to leave a comment or two, even if it's an emergency, even if it's an emoji. Did I just say emergency? Even if it is an emoji. I had emergency, the drink that's supposed to give you extra vitamin C. I had some of that. I'm thinking about it. It tastes very sweet. But anyway, let's just go over something. So March happens to be my birth month and also myeloma action month. So I share this hashtag, more than myeloma, as a way of sharing awareness. And for those who want information on myeloma action month, myelomaactionmonth.org. I just wanted to share that. And what some folks are doing, they are lighting a candle that's red, or they're using red lights. I don't have a red candle right now, but I do have something that flickers red. But we are not in the disco, so we are not going to be doing that. Now, here's what happened recently. I had a PET scan. The results came out, and for the foreseeable future, there's no new lesions, no new injuries. There's still some evidence of the damage that happened in the back. And since I was sutured up in December of 2024, so far, my back and my skeletal system is fine, thanks to the PET scan. I felt it was important to have the PET scan done another time just to see if any of the back pain and discomfort episodes had anything to do with anything new that happened with my back. So I'm guessing that this is just something that I'm going to have to deal with for some time. Now, this also leads to another part of the appointment that I honestly was not really ready for. But once it was explained to me, I understood it and I was pedal to the metal. I had to get a bone strengthening injection. It takes about a half hour. They put an IV in my arm and they would inject this liquid called Zometa. There's another name for it. They call it zoledronic acid. And I'm just going to read to you a little bit about what is entailed. So it treats high calcium levels in patients with cancer. It's used to prevent or treat soft, brittle bones or areas where the bone structure was compromised. In the worst case, it could be osteoporosis. So typically, that treatment is given in some older folks as well. And it could be given for other unexplained reasons. Now, in my case, I have to take this drug quarterly for a year. So I have 3 more episodes where I have to take it. I was told that the strengthening of the bone structure starts to make a difference around the 6-month period. So we're in March. We could be looking at close to the end of the summer where I may be able to feel some of the positive results, hopefully earlier, as I intend to be a little more active in the summertime. I did not have that privilege last year because a good portion of that time I was under quarantine from the stem cell transplants. So a lot to look forward to. I get to do a little bit of more things while I am out and about. It is recommended that I get into uh, strengthening exercise, not to do too much. But one of the side effects that I was told is that I should be experiencing pain in the bones, in the joints. Since then, I have not had any new or unexplainable episodes of pain in any of the bones or the joints, with the exception of the back and the areas where I had discomfort. And now that you mention it, I remember extensive discomfort in the mid back, even after surgery, and I was expecting that area to heal a lot sooner. This could actually be a result of the Zometa that I took. It could be. Time will tell. So, that being said, um, I want to also read off what it says about zoledronic acid, also called Zometa. And the spelling of it is Zometa. Zoledronic acid, a type of drug known as a biphosphonate. It's used to reduce calcium levels in the blood, and it helps to prevent or to slow down the bone loss. So there are two types, or other types, but there's one process in bone building, and the cells are osteoblasts, the ones that break down the bones, osteoclasts. So typically, it's going to help rebuild the bone by filling in the areas that are somewhat porous. And this is important because as you get older, your bone structure changes. You're not growing as if you were 18 or 11 years old. Your bone structure changes. In some folks, it affects the way that you walk. It affects the way that you're able to lift things. So hopefully, I have a good experience with the process. Now, I gotta be honest with you. I am a bit nervous. I am approaching a milestone. I'm about to turn 50 years old. I will have been around for half a century, 5 decades, 365 days times 50. That's a lot of days. And I'm fortunate that I'm alive. I'm also fortunate that I actually beat this cancer. There was a point where I felt that maybe this would have been the end, but I quickly jumped out of that thought process. So, having said that, I just want to say that it means the world to me that people trust and believe in my abilities, and I owe it to the general public to be outspoken about the awareness of multiple myeloma, which happens to be the second most common blood cancer known right now. And one of the things that I hope to do as I turn 50 is to keep the movement going and to talk to folks, be a father to my kids, a husband to my wife, and a good friend, a good trustworthy friend and colleague to those who I know. So for that, I just want to say thank you for those who made a positive influence in my life. including my dad, who's not here anymore, including my mother-in-law, who's not here anymore, and many others who we lost. Uh, but I don't want to deviate too much. The next step for me involves maintenance. So I could be looking at quarterly visits depending on what goes forth with my body system. I recently had to stop taking the Remdesivir drug. I was told in advance that based on me being MRD negative or having sustained MRD negative, which is having zero traces of cancer being found in the body in 2 or more different tests, I could take the initiative to discontinue the Remdesivir. Now, this is the reason why I disconnected the use. I was starting to get symptoms a little more often than I expected. I know my hands started to get darker, my feet started to get a little darker. Um, Constipation became an issue. The the aches and pains, the fatigue started to be an issue, and we felt that even a new symptom to come out of right field, itchy hands, itchy palms, it was going to get to the point where I would probably get another symptom that would be uncomfortable or problematic for me. So I decided to disconnect my usage for the time being. I don't think I'm going to need it, but according to what the doctors see, we could always revisit. And it is my hope that the symptoms that I was dealing with before would subside faster and I can proceed to living a more normal life. Now, I'm still going to be under the care of the oncology team, but minus the dependence of so many drugs at one time. They're going to monitor my blood. They're going to monitor my symptoms. I'm still going to have to take tests because we got to see how the body is going to respond and react. Maybe there is something that I'm going to have to take in the future. I'm going to stay close to the doctor's orders, and we're going to take it from there. Having said that, I just want to thank you all for taking the time to listen to me. I know I've said a lot in this video. I'm going to turn 50 this week. I might do another video before I turn 50. But if I don't, I just want to say it's an honor having lived in my 40s. I enjoyed it. I wish I had more time in the 40s, but that's not how life works. And I am grateful for having positive results with the PET scan. I'm happy to hear that, this treatment to strengthen my bones will actually help with my body getting back into a sense of normalcy. Because the truth is, I've been through a lot. Just so that I don't forget, Myeloma Awareness Month or Myeloma Action Month is March. It's highlighted by the red candle, the red light, the maroon ribbon. I don't have a ribbon that's maroon, but that's also the sign for myeloma awareness. You will have seen the hashtags more than myeloma. I discuss it on YouTube and my other platforms. And I'm hoping that my message, my words, my experience will help someone, whether they're a patient, a survivor, a family member, a friend who knows someone who's gone through it, or someone who lost their life and had to go through that experience, I hope my presence gives hope. And not to mention, prayers worked for me. It could work for you as well. Be sure to continue watching my channel. Subscribe to my channel if you have not. Leave comments. Tell me what your thoughts are. And share with folks who you know and to folks who you don't know. Cancer doesn't discriminate. It goes after everybody. But one thing I can tell you, it feels good to beat it. You be safe. You be well.